Hi, Dr. Desmond White, gastroenterologist. I recently have a patient with liver cancer and hepatitis B, and he had many questions for me, and I think I will share with my viewer, and you may learn something from him. His first question is that he got hepatitis B. How often should he have come for a regular follow-up? He actually had been doing regular follow-up with his own doctor in Jakarta, but for the last 1 year he didn't do because he thought he feel well. So I told him under expert guideline, we advise hepatitis B patients, as long as you're a carrier, that you're at risk of getting liver cancer. The risk is very low, 0.5% per year on average. So we ask them every 6 months to come and do a scan of the liver, either by a MRI, CT or ultrasound, and a blood test called alpha-fetoprotein. Usually and hopefully every time you go to see the doctor is normal. Then the doctor will tell you, oh, congratulations, it's all normal. Come back 6 months later. But just because it has been normal over the last 2 or 3 decades, it does not necessarily mean that the future will be bright. Okay, for this particular patient, actually every time he go is normal, but 6 months ago he didn't go for the checkup because he thought he felt right, and this time when they check it, his AFP, the alpha fetoprotein, is more than 1000. Normal AFP should be less than 8 or less than 10. 1000 is very high, so that becomes a cancer. So every 6 monthly, happy carer should see a doctor for scan and the AFP. Even if the past has been normal, please continue to see the doctor. Second thing he asked is he had been taking a vaccine called tenofovir, and his viral load had been negative. He assumed that hepatitis B virus causes liver cancer. So when he can suppress the hepatitis B virus to be undetectable level for the last few years, he shouldn't have any risk of liver cancer. Unfortunately, he's wrong. When we know that hepatitis B virus level in the blood is a predictor for liver cancer. The more viruses a person has in the blood, the higher the risk of liver cancer. So we drop the hepatitis B level to a low level so to reduce the risk of liver cancer. But we can only reduce the risk of liver cancer for happy carrier when they're on treatment. We cannot drop it to zero. Why? That's because hepatitis B virus live in our body, in the patient's body. They are found in the blood, but they also found in the white blood cell and the liver cells. So even though they drop the viruses in the blood to an undetectable level, we can still find the virus in the white blood cell and the liver. We call it the cccDNA. So just because a patient with hepatitis B had undetectable hep B virus in the blood, it doesn't mean that he's free of the virus. He still has viruses living in his liver and the white blood cell, and we can drop the risk of liver cancer by half, but we cannot drop it to zero. The next question is, he had the AFP done in Jakarta, there were 1000. When I repeated for him, it was 2000. He was very worried. So I told him, well, number one, when you don't do anything to liver cancer, it will continue to grow. But when you have a lab done in Jakarta and the lab done here, there's a big difference. It may not mean that it had rapidly progressed, because different laboratory, a different setup, a different reference range, so you can't really compare apple to orange. Okay, yeah. The next thing he asked me is, the PET scan that I did for him showed no cancer spread. Does it mean that he had no cancer spread? Unfortunately, it's not. Liver cancer may spread. The risk of spread increases when the tumor is aggressive, and it shows aggressive features by having a big tumor size, grow rapidly, and having multiple nodes in the liver. So if they have already spread, we can pick up by the PET scan. But when they are very small and they are spread, we may not pick up on the PET scan. PET scan doesn't pick up all the liver cancer spread, especially when they're small and early. So I told him our thinking is like that. If there's a cancer spread on the PET scan, he probably has a spread. When the PET scan shows no spread, it does not necessarily mean no spread. I repeat, if the PET scan shows spread, it probably has spread. If the PET scan shows no spread, it doesn't mean no spread all the time. Usually yes, but we still have to watch it like a hawk after the surgery. So then the next asked me, the size of the tumor is about 4 to 5 centimeters. Is the size important? Actually, the size of liver cancer is not so important. What's important is the location and how many nodules, and also how healthy or how bad is a remnant liver. Because when we take out the liver cancer, we remove the cancer and throw it away to the lab. It's what is remaining that is important. So in a patient with a liver cancer, not very big, but it's in the center of the liver, then we can't remove it because after that, there are no more liver left. But for this patient, it was in the dome of the liver. We calculated on the CT scan and MRI, we can remove this liver tumor with a bit of a normal tissue, we call it margin, and the rest of the liver should be sufficient. So it is what's left behind that's important rather than this particular nodule. So he underwent surgery my colleague Professor Cheng operated. He did very well after surgery so far. And he asked me on day 2 of the surgery, alright, Dr. White, should I check the AFP today? Remember, alpha fetoprotein was elevated before the surgery. Now, after the surgery, he wanted to do it straight away. I told him, no, we don't test the alpha fetoprotein cancer marker immediately after surgery. That's because AFP hang around in the blood for about 2-3 weeks. So today he got an AFP of 2,000. We take out the tumor tomorrow. The next day, AFP is still 2,000 because whatever tumor secreted in the blood is still hanging around in the blood. So I told him, wait, maybe at the end of the week or maybe next week we check the cancer AFP and we'll be on a downward trend. In fact, after the resection, we expect the AFP to drop to less than 7 or less than 10. But over time, we will monitor the AFP together with imaging studies to see whether cancer come back. So these are the many questions that the patient asks. I think all of you guys, my listener that have liver cancer, that are at risk of liver cancer, or friends or family that have liver cancer, may benefit. This is Dr. Spencer Mike. Whatever question you want me to answer, put down in the comment below, and have a nice day.